Hi, I'm Meaghan Neuberger, and I'm super thankful to be making this video for JA today, and it's a great way to come to your class during the pandemic. I am a dentist. My practice is called Dental Essence here in Sioux Falls, and I'm a general dentist, and I brought this just for something cool to show you my skull, which not every dentist gets a real human skull, so it's a cool thing that I have in my office. So, like I said, I'm a dentist, a general dentist at Dental Essence. I started my career path by going to college at USD, where I was a biology major. After that, I took a year off and had a job where I traveled, visiting different colleges. And then I went to dental school at UNMC, which is in Lincoln, University of Nebraska. And so I have been in this job my entire career. I met with an older dentist who was considering retiring, and we worked together, and then I bought out his practice. I also taught for 3 years at the University of South Dakota Hygiene School at their satellite clinic here in Sioux Falls, and I enjoyed that very, very much. A typical day for me, we start very early, so I get to work at about 6:45, and I see patients doing a number of things, fillings or extractions or crowns, emergencies, trauma. We see babies at age 1 all the way up to patients that are 100. So I love that I get to see all kinds of ages of kiddos. The thing, I love this job because it allows me to see people and it allows me to help people, and my practice sees a lot of families, so I really love that we get to watch them grow. We get to see kids when they're little, and then when they go to high school and college, and getting married and having babies, so that's very important to me. Personal skills that I use on the job, being able to talk to people, explaining what their dental issues are, being able to listen to them, and I think it's important to remember people when you see them. They want to know that you care about them. So my work day is very fast paced. When I'm here, I mean, it's never boring. It's just a lot of work. While I'm doing those patients in my operatories, I'm also seeing hygiene patients. So when you go in to get your teeth cleaned, then we check your teeth. So it's always exciting. My work ethic, it's a good work ethic. Like, you come to work every day, you work hard, patients depend on you, they don't want you rescheduling, they schedule and they depend on you to be there. So that's very, very important. I've had all kinds of jobs prior to becoming a dentist. I shagged balls at a golf course, I worked at a grocery store, I babysat, I worked at a tanning salon, all of those things. If I could talk to my younger self about my career path, I would choose to avoid the pandemic, of course, but that's nearly impossible. I think the thing I could have done differently is choosing a different major in undergrad. I was just a biology major, and I think I would have done something that I'm a little bit more passionate about, like English, but that's what I chose, and I got through it. So this is the first career in dentistry that I've had, and I think that's very unusual. Most associateships in dentistry don't work out, and so I'm super thankful that mine did, and then that I continued to work. There's some questions about hiring people. When I'm hiring staff members, I'm looking for people who are dependable, who are professional, people who are willing to work hard, and people who don't stir the pot, and get along well with others. When I was in high school, I thought I wanted to be an optometrist, and I told my neighbor that, and he said, "Why don't you be a dentist?" And I said, "I don't want to smell bad breath." And he said, "Well, as an optometrist, Meaghan, you're going to be smelling bad breath anyway." So that's very true. So I'm very happy that I chose a career in dentistry. I like to do crafty things. I like to sew. I like to crochet. And so with dentistry, I get to do crafty things all day long, which is very fun. Yeah, it's busy. I have 15 staff members. I think the thing that I didn't expect with dentistry is that you also have to be a businesswoman, and so I own my own practice, which is a totally different skill set. Like, it's different to manage people, and that's challenging. There's a big business side to it. So it's very rewarding, and it's nice to be your own boss, but it certainly has its own challenges. My 5-year goal would be to have a partner. So to hopefully hire my associate as a partner. That's our goal for this next year, and sell half my practice. And so that'll be good to offer some more flexibility for me to be with my family. But being a dentist has been a great career. Early on in my career, I was one of a very few female dentists. It was very male dominated, and now there's a lot of female dentists, so that's really cool. And it just gives you, you know, it's good to be able to not have to work nights or weekends. Like, I still have to, you know, be on call for any patients who have emergencies during that time. But in general, it's really great to have that flexibility. So again, my name is Megan. I'm a general dentist, and I really appreciate you taking the time to watch my video. Thanks.